Hi, my name is Shian. I'm currently a third year medical student here at IMU. So I'm doing the ME 221, I'm doing the PMS UG program, and I am also a part-time staff at the library. So today I'll be doing a book review on this book called Netter's Clinical Anatomy 5th edition. So let's start with the basics. This book is a remarkable book authored by Hansen and John, a renowned expert in the field of anatomy. It is available in the IMU library in the eBook format in the clinical key, which can be accessed through the library's portal. So the two most popular anatomy textbooks used by IMU students would be Moore and Netter's. So Moore would be more of the clinical aspects, while Netter's would be more of the pictures and labeling. So this book would be helpful for IMU students looking to sit for their OSPE part in medical school, which would be the anatomy part of our program. So before we delve into the content, let me share about what I truly appreciate about this book. So it's a masterstroke in simplifying complex anatomical concepts. The organization of the material is exceptional, and it makes learning anatomy a breeze. Moreover, the illustrations, which would be a hallmark of Netter's work, are nothing short of brilliant, providing visual clarity that aids in understanding. So an example of the organization, you can see, it starts with the back, thorax, abdomen, pelvis, upper limb, lower limb, head and neck. So it's all clearly organized and easier for us to revise. So now let's journey to the heart of the book, which would be the content. So it is divided into several sections. As you can see, there is stuff like the clinical focus boxes, where these are clinical aspects of the book which should be of focus to us. So you can easily and rapidly access the pages of where this happens. So example, you want to search up, say, psoriasis, you can just Control F. And you can just go to the page which talks about psoriasis. Yeah, clinical focus. So you can easily and rapidly access information this way, and you don't have to go through every single chapter. Okay, so the next part would be these clinical focus boxes, which should teach us about the key points of the chapter. So say you are currently revising for your exam and you have no time to read the entire book, or you have read the entire book before and it's now close to your exam and you want to have a short revisation, you can just read the clinical focus points, which should be stuff that will be more likely to come out in our exams. So for example, this fracture part talks about the types of fracture. So there are closed fractures, open fractures, and fractures can be classified with respect to its anatomical appearance. So you can see here there's a closed fracture, open fracture, which protrudes through the skin, that is bleeding. Pathological fracture, green stick fracture, torus fractures, transverse fracture, oblique fracture, spiral fracture, comminuted fracture, and segmental fracture, and fractures at different parts of the body. So in this digital age, online resources are a game changer. So this book comes with digital content, enhancing the learning experience. Furthermore, having it in an ebook format means you can always carry this book in your pocket, ensuring you are always equipped with anatomical insights. So would I recommend this book to my colleagues? Yes, it's an effective tool for learning and retaining anatomical knowledge. Whether you're a student, resident, or seasoned healthcare professional, Netter's Clinical Anatomy has something to offer. It's a must-have on your journey to mastering the intricacies of the human body. So for example, like I mentioned before, if you're a student, there is this part in the book called the Challenge Yourself questions. So if you want to know, example, which topic or which chapters you are weak on, you can go to these questions and you can try to answer them yourself. So you can see there are a lot of questions provided. If we should be in the style of our exams, so this would be probably the OPA side of the CA, and then this would be the SAQ. So by attempting these questions, you can gauge your understanding of the chapter, and you would know then which chapters you need more practice to revise on. And as you can see, the answers are clearly provided, with explanation. So it's not just the answer. Example 1 is D. It tells you why the answer is D, so you can understand and retain information and knowledge better. And another thing is it also has treatment option. Example, like for breast cancer, you have radical mastectomy. It talks about radical mastectomy, and it shows you pictures on how the mastectomy is done, how the breast and the breast fat is removed. So say if you have an interest in surgery, this book would be a great step forward in preparing for a surgical career in the future. So yeah, you can see partial mastectomy, how it's done, the clinical pictures, what are the muscles, what are the tissues involved. So one of the true tests of any anatomical book is its real-life application. I've personally found that the knowledge gained from Netter's clinical anatomy directly translate into clinical settings. Whether it's diagnosing patients or example procedures like a radical mastectomy here, the book equips you with practical insights that are invaluable. So in conclusion, Netter's Clinical Anatomy 5th edition is not just a book. I feel that it's an indispensable companion in our anatomical journey. Its clarity, comprehensiveness, and clinical relevance makes it a standout resource. So I would wholeheartedly recommend it to anyone passionate about the wonders of human anatomy. Thank you for joining me on this comprehensive review of Netter's Clinical Anatomy 5th edition. If you have any questions, thoughts, or experiences with this book, please share them in the comments below. So don't forget to subscribe to the Libraries e-learning YouTube channel. Thank you.